Hello and welcome to Chapter 8 on menopause and hormone therapy. I want to just give you guys a little bit more information about how important this transition can be for women and also some of the difficulties and the benefits of going through menopause. So let's go ahead and get started. What is menopause essentially? This is when your regular periods just completely stop. And some of us are cheering for that because we might be near that time. So it's the cessation of your regular period. There are three primary stages. The first one is perimenopause, and that is essentially where you're not in full menopause yet, but you're beginning to exhibit some of the physical changes that will eventually happen in full menopause. So it's the stage right before menopause, almost like your cycle where some people go through PMS. So perimenopause is the PMS of menopause. The second stage is the traditional menopause phase, where you have gone at least a year or 12 consecutive months without menstruating at all. So an entire year. That's what we classify as full menopause. So in the previous years, your periods may become lighter, they may become a little bit less frequent, and we don't consider that menopause. It's still considered the pre or perimenopause stage. But once you have stopped for an entire year, then you are considered to have been in the traditional full menopause phase. And then lastly, the postmenopausal phase is essentially what happens after you have had your period cessation for 12 months or longer. So pre, active, and postmenopausal phases. There are a couple of different types of menopause. One is the natural menopause, and the other is a surgical or medical menopause. The natural menopause is when the ovaries are not working. They're failing to respond to the different hormones in your bodies. They're producing lower levels of hormones. The hormones that they primarily produce are estrogen and progesterone. So those are being produced at lower levels. Your ovulation is not consistent. Most of us ovulate around the 14th day. So that kind of gets thrown out of whack. And then you finally just stop having a cycle at all. And that is the natural course of menopause when there's no chemicals or medical intervention. And then during that time, during a natural menopausal phase, and actually even during a medical phase, which we'll get to in a moment, there are different cultural and geographical type of considerations. One of them is management options. Many women are not aware of the different types of treatments that can be used to help mitigate the effects of menopause. They just don't know. And some of that is due to society placing a large value on being young and youthful. I think as women, we've all kind of fallen into a phase where we view what society views as beautiful on ourselves. And that's simply just not true. There's beauty at all stages of aging. But society has this predisposition with health and youth being the top markers for health, and that can sometimes have a negative impact when senior citizens are looking for management options because they're not considered as important of a population in the United States. Just going into Walgreens, there are products that are priced absolutely out of this world that are supposed to help decrease or reverse the effects of aging. So everything in our society is geared towards looking younger, looking hotter, makeup, all the different types of treatments that you can put on your eyes, liposuction, everything is geared towards looking great and being youthful. And so sometimes there can be a disproportional type of emphasis on how we can treat our elderly population. And that is important for us because we all are going to age, and we don't want what our mothers and our grandmothers and our great grandmothers have faced to also be our reality. And that kind of goes into some of the stereotypes that we have. So I kind of covered two at one time. Then as we bump down to the U.S. disease model, menopause is not really a disease. It's not a disease. It's a natural part of aging. And even though there can be some negative impacts and they can be treated as a disease because there are medical interventions that can help mitigate effects of menopause, it's not really a disease. It's a natural occurrence in the body. And lastly, information gaps. Some of these things, as you can see, all 5 of the bullet points, they flow into each other very naturally. As we become more informed about what menopause is, then we can start to make different types of decisions for ourselves and even the people that may be under our care. It's very, very common for women to take care of their parents, and remember that because we have a longer lifespan, we are looking at being the primary caregivers for our parents. Now, some positive aspects of menopause. So it's normal. Don't freak out. There's nothing to be afraid of. We are starting to have a more open type of belief system around menopause. And having that discussion is important so that we can have changes and more research and more options for women. You don't have to worry about contraception because you're not going to be having periods anymore. And that is great if you're not looking to get pregnant. So that's a great positive. No more birth control, no more patches, no more shots, no more any of that. There are fewer family obligations. Part of this is just because you get older and empty nest syndrome happens in the house. All of your kids are older. So as you go through menopause, then there are fewer family obligations. And you can take on obligations either familial or in the workplace that you may not normally have been able to because of your previous obligations. But as we go through menopause, things start to kind of taper off in our lives. It's our golden years. And so these are some of the positive aspects. And then I want to talk about the medical or surgically induced menopause. This chart here shows the 4 different types. The partial hysterectomy up here in the left-hand corner is when only the uterus has been removed from the body. It's the least radical of all 4 types, but you still are going to have menopausal symptoms. You still will be in menopause, but you will have less symptoms than someone who has had the other 3. Moving right along, we look and see that in a total hysterectomy, it's both the uterus and the cervix that are removed, both of them. So in a partial hysterectomy, just the uterus. In the total hysterectomy or full hysterectomy, as they say, then the uterus and the cervix both are removed, but the fallopian tubes and the ovaries are intact for both of these. Moving down here to the total hysterectomy, these are bilateral fallopian tube and ovary removals. These types of hysterectomies tend to produce much more prevalent effects for menopause. So both the cervix and the uterus are going to be removed, along with the cervix actually too, and both ovaries. So you're looking at almost a complete and total removal of everything. The only 2 differences between the total hysterectomy and the radical hysterectomy here are that in addition to the ovaries, the fallopian tubes, cervix, and uterus, lymph nodes in the area are also removed. Usually these 2 types of hysterectomies only really happen when absolutely necessary for health, such as, uterine cancer, cervical cancer, or something of the nature. It is also sometimes a surgery that will be performed on women who have breast cancer because of the hormones that are produced by the female reproductive system. They can have a negative effect on individuals with breast cancer. I know that my mother was stage 4 breast cancer. She had bilateral breast cancer at 2 different stages in her life, and they ended up just doing a total radical hysterectomy because they were trying to reduce the chances that the cancer would metastasize in another area. And so, which it apparently did, but they were trying to reduce the chances. So these 2 types of surgeries are really not standard types of surgeries that are performed. Usually the partial hysterectomy or the total hysterectomy are going to be sufficient. So when you have a hysterectomy, it's supposed to be for something that is medically necessary. These are not elective surgeries. It's known to be outweigh some of the detriments of whatever the medical condition is going on with a woman. So results for these types of hysterectomies, the more severe or the more total or radical hysterectomy that you have, you're going to have more severe symptoms. And when we look at what some of the negative impacts are, we see that women who have had both ovaries removed, so a bilateral removal, before age 50, so before you would normally start menopause, which is between 50 and 55 years old, they have a heightened risk for cardiovascular disease and chronic heart disease and stroke. And these are some of the 3 top killers in the United States. So it can be a detriment for a woman, but once again, a hysterectomy is usually supposed to outweigh the detriments of whatever else is going on. And these are some of the other impacts of menopause: hot flashes, depression, sleep disturbances, vaginal dryness. That also will go into some of your sexual activity. You may not feel as into the act, so your libido is decreased. The vagina is a muscle, and it can begin to atrophy. Your weight can fluctuate, skin changes, dryness. So overall dryness and dehydration in the body can happen, not just in the vaginal canal, but also with the rest of your body. And then UTIs become more prevalent in women too. UTIs tend to affect women more. And so with menopause, then urinary tract infections, they actually can have some sort of impact with the hormones and with the removal of the fallopian tubes and or the ovaries. Then you can sometimes be more susceptible to urinary tract infections, and then urinary incontinence as well. So when we look about mental health, because depression can be a side effect, it's not something that always happens. Some women exhibit very few symptoms of menopause at all, and therefore they don't have a need to speak with an industry professional for mental health. But other women have a lot of different symptoms, and because that can be very taxing, especially in your older years, to go through something like that, they tend to seek out medical and mental health options. And that is a conversation that has to happen, because we know that medical care for the elderly is going to be increasing in the next 10 to 15 years. And that will include some of us who are in our 30s, 40s, and 50s. And so it's very important to understand the link between menopause and mental health, and that your body is going through a lot of changes. It is in some ways similar to puberty, but now you have a decline of hormones. So there are going to be some emotional and psychological impacts with that. Complications: cardiovascular disease. Yes, you are at an increased risk for cardiovascular disease, also osteoporosis, which is a weakening of the bones, urinary incontinence, and that can be linked back to the previous slide when we talk about UTIs. Unfortunately, weight gain is also one of them, and that's something that women are never too thrilled about, including myself. And there is medical discourse about a potential link with dementia, which is the precursor to Alzheimer's. But the general consensus is probably not, very unlikely, but there are still some medical practitioners who believe that there can be a link with dementia with the various changes that happen in your body during either a surgical or a natural menopause. But the biggest two are really cardiovascular disease and osteoporosis. I want to talk about some of the treatments as far as hormone therapy is concerned. This has been a long-standing treatment for menopause, long-standing. And it really wasn't too much of a big deal before the 20th century, because the life expectancy was so low that there was really no need for hormone therapy, because people were dying out very, very early. But as medical advances have been made and we have started to take a different look at health, and life expectancy has continued to go up for women even more so than it has for men, then preserving quality of life for women during the pre-active and postmenopausal phases has become something that's more of a medical issue. And so this has been a standard treatment to replace hormones that are lost through the different female organs during menopause. Two primary forms: estrogen alone. This is for women who do not have a uterus, whether or not you had this removed during surgery. And then there's estrogen plus progesterone. And these are the two hormones that the female body produces in greater amounts when it allows for us to be able to have secondary sex characteristics, primary and secondary sex characteristics. And they also just kind of help to regulate our bodies so that we don't have some of those negative effects of menopause. So additional studies, we're going to get into that a little bit later on the continuation of this mini lecture. But the additional studies show that diet modification, exercise, these types of healthy practices actually help reduce the risk of heart disease, fractures, and cancer. And I'll talk about that in a moment.